Hello, I'm Bob Waddell, Training Manager for SAM Medical. On behalf of myself and Team SAM, thank you for the privilege of allowing us to provide you with this introduction to the SAM Intraosseous Access System. At SAM Medical, we exist to measurably improve pre-hospital care through innovative solutions to the toughest challenges in the field. This is not only our mission statement, but our commitment to you, to our distributors, to healthcare providers in every environment, and to the patients whose care includes our products. Over the decades, numerous peer-reviewed studies have been published demonstrating the use and effectiveness of IO access and subsequent fluid and medication therapies. In the early 2000s, the EZ-IO power driver and needle system was introduced. On March 2, 2020, after several years of careful evaluation, extensive engineering, feedback from real-world product and clinical experts, SAM Medical revolutionized IO driver and needle technology with the introduction of the SAM IO Access System. SAM Medical has taken effectiveness and efficacy to a new, higher level. IO access is preferred anytime vascular access is unnecessarily difficult, unsuccessful, or otherwise needs to be achieved rapidly during an emergent, urgent, or medically necessary situation per your local protocols, medical directions, or regulations. These situations include various forms of traumatic injuries, difficult IV access during critical events such as hypovolemia, stroke, cardiac arrest, veins damaged from chemotherapy, IV drug use, or numerous other medical conditions. Or when a healthcare provider recognizes IV cannulation will not be successful or will consume excessive time to achieve. When not to use. In certain conditions, IO therapy should not be used. They include previous surgical procedures where implanted devices or appliances such as plates or replacement joints remain at the targeted site, bone fractures at or near the targeted site, previous IO catheterization or attempted catheterization in the same bone within the past 48 hours, infection at or near the targeted insertion site, or the absence of definable landmarks due to excessive tissue or other anatomical variations. The SAM IO Access System has numerous attributes providers around the world have been requesting. It is engineered to facilitate efficient, controlled needle placement consisting of a quick connect hub allowing for rapid needle attachment and removal, a ratcheting mechanism enhancing the precision boring capabilities, ergonomic, non-slip grips. The driver is lightweight, weighing a mere 2.5 ounces and only 2.95 ounces with the needle assembly attached. It has a small footprint, 5 1/2 inches tall, 4 1/4 inches wide, and 1 inch thick. Engineered to fit a wide range of provider hand sizes and strengths for ease of use. A passive ratcheting mechanism which provides proficient rotational boring for controlled needle placement. Manually operated means no battery failure, no overheating, and no associated concerns. No spring to cause over or under bone penetration. And SAM Medical has a validated cleaning and disinfecting procedure to assure it can be rapidly placed back in service. The SAM IO needle assembly consists of a simple multi-hub needle system. The Stylet hub attaches to the SAM IO driver with a simple snap connection. The catheter hub connects to the Stylet hub with a similar snap connector and contains a lure lock connection. All needles have a safety cap as well. Available in industry-recognized lengths and colors: pink 15 mm, blue 25 mm, and yellow 45 mm. Each needle is engraved with a precision reference mark to assist with proper depth positioning. The laser markings are each 10 mm from the tip with a 5 mm marking nearest the needle hub. All SAM IO needles are 15 gauge. The catheter is designed with a 5-point grind cutting edge, and the stylet tip has a double diamond grind for precision boring capabilities, consistent with orthopedic standards. Needles are available in a single 1-pack or a 5-pack bundle. SAM IO needles have a 5-year shelf life. The SAM IO Access System accessories include the needle adapter, which allows for other brands of IO needles to be used, reducing costly waste, a stabilizer, which is used to protect the IO catheter once it is placed. The SAM IO Access System is indicated for all target sites currently accepted by industry standards, bilaterally. There are 3 common sites for adult and adolescent patients and 4 common sites for pediatrics, per your local protocol's medical direction or regulations. Properly prepare the equipment and patient's injection site per approved procedures and protocols. Assure the patient is in the proper position for the selected IO site. Attach the selected SAM IO needle to the driver. When ready to penetrate the skin and bore into the bone, remove the needle safety cap. Insert the needle through the skin and adipose tissue until bone contact is felt. Once the needle has engaged the bone, then and only then, begin actuating the SAM IO driver. Apply continuous, rapid actuation of the SAM IO driver while also providing gentle, steady, inline, and downward insertion pressure. You should feel a pop or sudden decrease in resistance as the needle enters the medullary space or bone marrow cavity. Immediately stop actuating and stop applying downward pressure to the SAM IO driver. With gentle downward pressure, allow the rotating needle tip and cutting edges to be the primary mechanism to bore through the bone and penetrate the medullary space or bone marrow cavity. Actuation speed with gentle pressure is more effective than brute force. Manual placement of an IO may be required in situations such as mass gatherings, mass casualties, or whenever multiple patients are encountered. Hold the needle assembly in the palm of your hand. Penetrate the skin and adipose tissue until the needle engages the bone. Begin rotating the needle back and forth in a straight line while also applying firm downward pressure. Continue the procedure until the needle penetrates the bone and enters the medullary space. This is usually felt as a pop or sudden decrease in resistance. Immediately stop rotating the needle and stop applying downward pressure. Confirm proper placement per local protocol, medical direction, or policies. Remove the stylet by pulling the stylet hub straight out and away from the catheter hub. Place the stylet in the supplied needle vise or an approved sharp safe container. If you choose to hold the catheter hub during stylet removal, hold the bottom 1/2 inch of the catheter hub with your non-dominant fingers below the connection of the stylet hub. Pull the stylet hub straight out and away from the catheter hub. Place the stylet in the supplied needle vise or in an approved sharp safe container. Please follow all applicable SHARPS protocols and/or policies. Attach a syringe to the luer lock connection of the catheter hub. Withdraw bone marrow fluid or infused fluid per local protocol. Remove the syringe and attach either the extension tubing and/or the SAM IO stabilizer. Place the SAM stabilizer over the catheter with or without the extension tubing pre-attached. Locate tab 1 and gently pull the backing off to expose the adhesive side of the device. Then press firmly to assure contact with the patient's skin. Pull tab 2 in a similar fashion to fully secure the device. If not done previously, attach readied extension tubing to the catheter hub. Connect fluid or medication delivery setup and administer fluids or medications. For patients responsive to pain, consider administration of anesthetic such as lidocaine per protocol, medical direction, policy, or regulation. Disconnect extension tubing from the catheter hub. Connect a 10 milliliter luer lock syringe to the catheter hub. Rotate the syringe and catheter hub while applying gentle upward pressure. Place removed catheter in Sharps container and dress wound per local protocol's medical direction or regulation. Using a clean cloth or soft bristled brush, moisten with 1% Alkanox or other approved cleaning and disinfecting solution. Wipe down all surfaces of the SAM-IO driver. If the internal parts appear contaminated, submerge the driver in 1% Alkanox or other approved cleaning and disinfecting solution for 5 to 10 minutes, per their manufacturer recommendation. Afterwards, actuate the driver 1 to 3 times to assure proper function. If contaminants remain, repeat the process. The driver is manually operated. No battery or artificial power supply. Resilient design facilitates thousands of catheter placements. Small footprint, durable, and lightweight. Intuitive needle sizes and colors. 5-year needle shelf life. Adapter for use with other IO needles. Single needle pack or 5-pack bundle. Reduced cost per application. On behalf of myself and Team SAM, thank you for the honor of being able to provide you this information on the SAM IO Access System.